So, compassion fatigue is a mental disease that inflicts emotional trauma on a lot of caregiving professionals, people in the caregiving professions. This includes nurses, doctors, veterinary nurses, nursing home assistants, anyone who works in the profession of caring for someone else. Compassion fatigue is also known as secondary traumatic stress, or vicarious trauma, or even secondary victimization. Secondary victimization, I think, is probably, for me, is the best term to use for that, because whenever you have compassion fatigue, you are metaphorically, although sometimes it can even feel like it, taking on the burdens of the patients that come in to wherever you are. So for us in the veterinary medical world, this is an extremely important thing to know, especially if you're just learning, if you're just a beginning student in the veterinary world. This is extremely important for you to know because you most likely will get this. I can almost say probably 100% of you. Although research does say only about 70% of vet professionals experience compassion fatigue. I would say it's probably everyone, but to different degrees. This is very, very important to know because this is probably one of the biggest causes to the 75% of suicidal feelings in the veterinary world, because it causes pain, mental, and sometimes it can even come out physically, pain to the person who has compassion fatigue. So what is compassion fatigue? Well, basically compassion fatigue is when a person in the caregiving community, in the professionalism, is taking on the burdens of their patients. So this can include, in the veterinary world, this can include the pains of the animals, especially when it comes to euthanization. That takes a very heavy toll on the body and mind of the person euthanizing, and involving themselves in the euthanization. And also the patient's owners. That'll include whether or not they can pay bills, whether or not they can truly keep the animal, and that's why they have to put it down, or just the pain that they go through. And the one thing about compassion fatigue in the veterinary world is that you're experiencing it just about every day. Research says that vet professionals face about 3 to 5 ethical dilemmas every single day. And that's insane. So you can also face it if you are just taking care of animals, like at a humane society, at a shelter, because you have to deal with the pain of the animals coming in and the pain of the people who have to bring them in, and just dealing with all that emotional stuff. So what are some symptoms of compassion fatigue? So some symptoms are bottling up your emotions. Whenever I had compassion fatigue last semester, I worked on a dairy as a calf feeder. We had sick calves dropping left and right. I was dealing with an emotionally stressful coworker who was constantly dumping her emotions on me. I was carrying the burdens of all those animals and of my coworker and even of my boss on my back. And so what happened was I would bottle up all my emotions. I wouldn't show emotion. I would get so wound up with all the emotion inside me, I just hold it back because I didn't want to let it go. And that caused a lot of fatigue. You also have difficulty concentrating. For me, I couldn't concentrate on more than one thing at a time. I could not multitask. It includes isolation. You isolate yourself. You don't want to be near other people. You especially family, because family will notice first. The family will always notice first. For me, it was my family. I just wanted to stay away from them. I found every excuse to go over to my boyfriend's house, to leave, to go somewhere. I would go to the library just to go to the library and get away from my family. You also have like mental and physical exhaustion. I thought for me that I was waking up at 5 a.m. every Monday through Friday, and I thought I was just exhausted. and I wasn't. It was literal compassion fatigue. I was experiencing that. So you'll have nightmares or flashbacks. One of my coworkers had all of that. She was experiencing compassion fatigue to the max. So how can you take care of yourself if you have compassion fatigue? If you think that you have compassion fatigue, you probably do. What you can do is ask other people. Don't be afraid to ask your family or friends, hey, is there something wrong? Does it seem like I'm a bit different lately? And generally they'll be able to say, yeah, there's something off. I think there's something off. Be open to accepting help. I know that a lot of people don't want to, me included. I didn't want to seek help. Also, if need be, pull yourself out of the situation. I had to quit my job, which even though it was a seasonal job, I had to tell my boss, hey, I have to be done by this date. I can't go any further. This is my last date. I'm not coming in after that. Please do not ask me to. And that's something good. You need to cut yourself off from that. And just cut yourself off. Give yourself some vacation. Take some time for yourself. One of the big things about being a caregiver is that you have to take care of yourself too. You can't just take care of your patients. You have to take care of yourself. What you can also do is, if you have more questions, if you need some resources, if you're going, okay, so if I want to go seek help from a professional, maybe if your family isn't available to talk to, if you need to go to a professional counselor, you can also go to compassionfatigue.org. Compassionfatigue.org is the site for the Compassion Fatigue organization of the United States. It was founded by Patricia Smith in the 90s whenever she realized that compassion fatigue was a real thing and that she had it and that it needed to be dealt with. So go on there. They have tons of resources. If you are in the veterinary world, they have a lot of resources specific for animal caretakers. They will be able to, you can call them, they have the suicide prevention hotline on there as well. Just if you think that you have it, I would highly suggest going on that website, looking it up, ask your family and friends, hey, is there something wrong? Do you think maybe I'm a little bit different than I should be, than I normally would be? Am I less happy than normal? So just don't be afraid to ask. Go to compassionfatigue.org, research a bit more, and try to seek help.